Hello, I'm Dr. Sandra Fryhofer. Welcome to Medicine Matters. Today's topic, men, osteoporosis, and alcohol. New guidelines from the American College of Physicians and a new clinical practice review in the New England Journal of Medicine. Here's the concern. Overall, 1/3 of all hip fractures occur in men, and here's why it matters to doctors of internal medicine. While men have a lower lifetime risk of osteoporosis, fractures in men can be more deadly. More men die during the first year after a hip fracture compared to women, twice as many in fact. The 1-year mortality rate for men is double that for women. Bottom line, osteoporosis concerns are not just for women. That's why the American College of Physicians says men, especially men over the age of 65, need to know where they stand. They need to be screened for osteoporosis risk factors, and men at risk need a DEXA scan. The most important risk factors to look for include low body weight, a BMI less than 20, weight loss greater than 10%, physical inactivity, not being active on a regular basis, and a history of previous fracture. Also, check their meds. Look for medications that could increase their risk, like steroids or androgen deprivation therapy used to treat prostate cancer. The guidelines' take on alcohol may surprise you. Remember that they weighted and they graded the data. The guidelines say that although use of alcohol increases probability of fracture, meaning you might be more likely to fall, they didn't find any studies proving that alcohol actually lowered bone mineral density. Cigarette smoking and low calcium intake are a different story. They have been linked to low bone mass density. So some things remain the same for men and women for prevention. Regular weight-bearing exercise, adequate calcium intake of 1,200 to 1,500 milligrams a day, and for now, vitamin D doses from 800 to 2,000 international units per day. The new guidelines stress that osteoporosis in men often goes undiagnosed and undertreated, and that it's under-researched. Over the next 15 to 20 years as our population ages, we may have more problems. The guidelines warn that without more screening and treatment for men at risk, we can expect hip fracture rates to double or even triple. What's your opinion? What do you think about these new recommendations? Drop me a note on the Physician Connect discussion board because I want to hear from you. For Medicine Matters, I'm Dr. Sandra Fryhofer.